Bose In-Home Care is a Medicare certified home health agency. One of the things that makes Bose very unique is that the quality to patient care is something we don't just talk about. It's not just a marketing pitch for us. It's something we genuinely care about.
We always need our employees and we need our people no matter who they are in the company, whether you work in the office, you're a clinician in the field, or you're in the sales team, you're dealing with someone's loved one. That is truly what is important to us.
I think that our frontline care providers, whether they're our caregivers, our aides, our nurses, our therapists, these are all individuals that are out there, not just doing a day-to-day job. This isn't a 9-to-5 for them. They genuinely do care about doing it right and being there for the well-being of their patient.
Because home health care is the most intimate form of health care going into someone's home, you need to make sure that your people feel supported.
Our clinicians are very well informed prior to going out to that patient's home. So as the referral comes in, you're going to get the history and physical, you're going to get all the doctor's orders, you're going to get labs from the hospital, and that way they can review all of these documents so they know what they're walking into. So they can kind of prepare before they go into the home exactly what they're in for, how they're going to be able to help that patient.
There is so much going on with individuals from a social aspect to also a clinical aspect, and you never know when you're going to be in that situation. So for us, we try to keep the business as real as we can and as human as we can.
You become extremely close with the families and the patients.
We're talking about someone's loved one, someone's mother, someone's father. This is about people. This is about people's lives.
We don't just go in there and take a blood pressure. You're teaching, you're possibly doing an IV, you're doing wound care, wound vacs, you may have a trach. You're teaching these people how to be independent, empower them to be able to take care of themselves.
When you provide the care the right way from the beginning to a senior, you are doing things such as getting them back on their feet faster, getting them back to being more independent. We're avoiding hospital readmissions. We're improving fall safety and risk factors. If we were not there to do some of these things, these individuals would have dramatically different lives and sometimes very detrimental. And we have an opportunity to impact that in a very positive fashion. And it's not every day that people get to come to work and enjoy what they do at the level that we do.
To see how you can make such a difference in somebody's life and keep them out of a hospital, it's a beautiful thing.
We're not changing the global world here, unfortunately, but we certainly are changing the world as it is for some of these people.